Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to Okay, I will start now. This is good evening here and good afternoon for Dr. Lindsey Whitfield there in England. Selamat malam buat semua peserta yang hadir di sini. Hari ini saya berkesempatan untuk mewawancarai teman saya nih, berbicara dengan teman saya, Dr. Lindsey Whitfield dari England, UK, ya. Selamat malam, assalamualaikum buat yang hadir. Terima kasih atas kehadiran Anda semua. Thank you for joining us today in my webcast, Dentistry Talk with Imankusumadirja, and with our special guest for tonight or today, Dr. Lindsey Whitfield. How are you, Lindsey?
I'm good, thank you. Yeah, and we have sunshine here.
Yeah, and it's kind of a bit dark right now here in Indonesia, in Jakarta.
Yeah.
Okay, first of all, I would like to introduce you to our participant for tonight's webcast. Dr. Lindsey Whitfield began her career in hospital dentistry, and now she's working as a general practitioner in Salisbury, right? Salisbury, okay. Salisbury. And she's currently practicing with dental laser for the last 3 years, right? And also did a diploma in laser dentistry at the Laha Institute in Slovenia. And also she's my fellow student in Università Cattolica del Sacro Cuore in Rome, and we are almost finalizing our final thesis. So, Lindsey, how are you?
Yeah, I'm good. A little bit frustrated because I'm not back at work yet.
Okay.
Although the weather's lovely and it's quite nice to be.
Yeah, it's very bright there.
Yeah, but no, it's very frustrating because I feel like not. Yeah, it's been a long time that it's more than just having a 2-week holiday. It's too much. So it's just a frustration now is sort of really getting to me. Because of the current situation. I know that obviously we have had a big problem with the COVID-19 here, but we look at other colleagues around the world who
yes, that's true.
Yeah, we have had a situation where we were told to shut, and then we didn't really expect to be closed for so long.
Yes. Actually, how many days have you been not able to go to work?
Well, it was March that we got shut. So, yeah, it's been weeks. I think it's been about 12 weeks.
Yeah, it's 3 months. Wow.
Yeah, crazy. So all we can do is telephone advice.
Is it totally restricted?
So, it's a bit different here to a lot of other countries because we have a national health service, which we have practices that are solely national health or sometimes mixed, so some national health, some private, and then we have sole private, which is what I am now. But we have a lot of regulatory bodies in the UK. So we have the National Health Service that is overruled by the Chief Dental Officer for England, and then there's one for Wales and one for Scotland, and one for Ireland, and they oversee NHS dentistry. but supposedly not private. And then we've got the CQC, who are the Care Quality Commission, who they oversee the standard of care, like things like the sterilisation, how we're looking after patients, making sure that we're safeguarding them, that sort of thing, that the practices are being run properly. So we have them, they oversee everybody, so all practices. And then we have the GDC, which is the General Dental Council. They are there to make sure, they're there for the protection of patients, and we have to register with them. And then we have the indemnity organisations who insure us to work. So all these different groups have the power to stop us from working.
So I think there are a lot of regulation that you have to fulfill. I mean, to go back to work, and if you fulfill those requirements from the regulatory body, can you do your practice? I mean,
we can now.
That easy?
Yeah. So what happened was originally was the CQC told us we had to shut our practices.
Can you tell me what is CQC? Maybe the
Care Quality Commission.
Okay.
So they said the Chief Dental Officer, who oversees NHS, said all practices have to close and cease face-to-face contact with patients.
Okay.
Then the CQC said, right, all practices have to close. And then after a while, the private practices said, hang on a minute.
Okay.
We're not NHS. Why us down, right? So then they're like, no, you have to do what the chief. And we were like, well, wait a minute, because what happened was the NHS practices were still being paid by the taxpayer, but the private practices had nothing. Okay. We were not very happy.
So it's very economy related, right?
Well, I mean, obviously, you understand to start with that we have a pandemic, it's an unprecedented situation, we understand these things. But then when there was no help forthcoming from the government, we started to get quite upset about it. So we're like, well, hang on a minute, what's your justification for closing down? Because what happened then, after they initially closed us down, then after a few weeks went by, they were quite slow. They then set up what they called emergency dental hubs. So anyone who had severe pain, and it had to be really severe, could be referred to one of the NHS emergency hubs for treatment. So it was quite limited to things like extractions. If the patient was swollen and they had 2 courses of antibiotics and they were still having problems, then they could go, but more often than not, all they were offered was an extraction.
Okay.
And the practices had to follow the protocols with full PPE, everything, and a fallow time of 60 minutes. I don't know where they got that one out of the air.
So
anyway.
So when you said that for the emergency patient can go to the NHS, I mean, what is the preparation or for the facility or the standard for the NHS?
Well, this is the thing, you see, because our argument was, well, if you can provide emergency care, why can't we? Because we were like, we can buy the PPE, we can set up our own protocols that, by the way, might be even more stringent because we are private. And lots of our private practices, we are very experienced practitioners as well. You don't tend to go straight into private dentistry unless you've had quite a few years of experience first. Yeah. Because you know that the standard of care has to be very high. So, so we were quite upset because we were like, well, you're almost treating us like you're saying only we can provide care to patients. Right? So we actually challenged it, and then it took a while. But then what happened was that the government realised that they had done the wrong thing. But then what they decided to do was to suddenly announce that we were able to open without actually telling us first.
I have it's very interesting because did the government say they're doing the wrong thing?
Oh no, they never would.
No, right?
No, it was like, oh, we've got a really great news for everybody, you know, general public and you dentists. You can open, but obviously opening after you've been closed for several weeks it's easy to shut everything down and lock the door, but you have to go in and you have to set up your protocols, you have to make sure you have all the PPE, you have to do a risk assessment, you have to make sure the equipment is properly cleaned and ready to go and it's all, you know, maintained, because if something's not working it could be a disaster. Especially now with the COVID-19, if you haven't got a little suction working, for example, you're going to be in big trouble, aren't you? So so it's not a simple job of just going, oh that's fine, we'll just open the door again and we'll just walk in. That, you know, turn the compressor on and off we go. No, it's not that simple. So,
I'm sorry, I quit. I'm thinking, and it's quite interesting. I want to know the standard that the NHS apply to their facility. Do you know any information about the standard that the NHS
uses? They do have strict protocols, you know, that they're in full PPE. I don't know about things.
Do they change the PPE for every patient?
Yes, but of course they're only seeing about 4 or 5 patients a day.
The
number of people that had problems was far greater than the capacity they had to treat.
Of course.
So then we had a situation where we had people actually taking their own teeth out with the pliers out of the garage.
So
there were a couple of people that did that.
Do they ask for anyway, are you back at work right now or still in lockdown?
No, some of us are back at work, but it's only about 10% because of the problems that we've had getting equipment. Like I'm still waiting for things that I've ordered to arrive.
Oh, okay.
So, I mean, one of the things that I find, so there's a couple of things that I found quite frustrating. First of all, the amount of PPE that we're having to get through. I feel like in this age where we're trying to stop wrecking the planet
by waste.
It's ridiculous the amount of, one day the whole dustbin is full of PPE, so and plastic bags and all that. I know it gets incinerated, but the other concern I have is not to do with dentistry, is the amount of PPE that the general public are using and just throwing down on the floor, you know.
Oh, really?
Because they're not educated like we are. You see, dentistry was already very safe. You know, we've been dealing with HIV and hepatitis B and all sorts of nasty germs for many years, and we have already got strict protocols. But now you have the general public just trying to stop transmission of the disease. They have no idea how infection control actually works. You know, they don't even know how to wash their hands properly, most of them. So, you know, I find it quite annoying that, you know, we were already following protocols, and you know, even the hospitals, when you look at, I mean, obviously they were actually treating known COVID patients, and our protocols are stricter than theirs. You know, I had to go up to London for a fit test. Anyway,
Lindsey, before we go further to talk about dentistry in the UK, can you share us, you know, your side or your experience? How about the pandemic is affecting your country? I mean, generally, and maybe in economy, how it's ruined the country. I mean, can you tell us something?
Gosh, I mean, it's so complicated, isn't it? I mean,
yeah.
So one big problem that we had was in the government's desperation to protect the hospitals, protect our National Health Service. They were really focused on that. And so what happened was they tried to clear the hospitals out of a lot of patients, and they inadvertently sent patients back into care homes that actually had the virus.
Yeah.
So then we had a lot of elderly people, and they are the people most likely to die. They were the people who ended up catching it more. And I think they should have focused on shielding those people first and foremost. So they did lock down a bit too late, and they should have shielded those people a bit earlier. I mean, you've obviously got to learn lessons, haven't you? So in the future. But I think we had enough lessons, and we could have looked to countries like yours where you've already had to experience these things. Why didn't you get affected so much when actually you're geographically closer to China? That because you've learned from previous experiences, especially
probably, but also maybe the information is not accurate. Maybe, who knows?
Yeah, true. And also the demographic of the people.
Yes.
Where they're living, how many elderly people there are, how many people with more underlying health conditions.
Yes, that's true. Comorbidity.
So there's a lot of studies that need to be done. They're going to keep it's going to keep the epidemiologists busy for a long time, I think. But I just hope that we do learn the lessons from this. I mean, we also had there was a problem with PPE because I mean, this is obviously press reports that the UK government was warned a while back that if we had a pandemic that we wouldn't have enough PPE, and we had PPE in stock, but they weren't testing it. So they were I mean, apparently you can change the date, the expiry date on PPE, providing you tested it. And they weren't doing that.
Oh, okay.
I think the PPE issue is going to be a big one worldwide, actually, because I also heard that Australia sold a lot of their PPE to China. China didn't tell them how bad things were, and then they would upset people in Australia.
You know, there's also a friend of mine in Italy who was asking me that they want to buy PPE from Indonesia because he already contacted his contact in China, and they say that the PPE is not available at the moment. So he was asking me, can he bought the PPE from Indonesia? But unfortunately, there's some regulation here that we cannot send PPE outside. And then also, so anyway, how this pandemic infected your economic in the UK?
Well, it's really bad. I mean, the latest reports was that we had it was massive drop in the economy. I think it was even something ridiculous like 20%.
20% decrease?
Yeah, but the forecast is going to be 11 point something. The thing is, I think it's very difficult because if you take like 2 or 3 months, obviously we know why it's dropped so drastically. The question is how quickly is it going to pick up again? Because it's like the value of the pound and now it's come back up. So you take an average, don't you? So over the year. So but the big worry is unemployment.
That's what happened all over the world. I think it's just in Europe or Asia. I think it's in America. It's a little bit horrifying because all the people are doing this demonstration. They go to the if all of the people in America, putting themselves in the risk. I mean, maybe in 2 weeks from now, there will be some,
yes, this is the worry here as well, because we've had the same thing in London, a lot of demonstrations and violence as well. Other cities as well, actually, where the social distancing has gone out the window. And actually, there are a lot of these people. I can understand why they're demonstrating, but it's just bad timing, because a lot of them are in the high risk groups as well. So they're putting their own lives at risk as well. So yes, in 2 weeks' time, it's very interesting to see if we get a spike in the numbers again, which will be a disaster, absolute disaster. How are things in your countries with because the biggest problem is the tourist industry and restaurants and places like that, where you can't, people are not going to get the same level of enjoyment going out to a restaurant when you're sat 2 meters apart with the person next to you. And how are you going to manage that? It's just going to be so difficult.
Yeah, there's a comment. There is no regulation regarding export of PPE from Indonesia. Even we imported to Korea, but I think that was when the PPE price is rising up in Indonesia, and I asked some regulatory body that's doctor, we cannot allow you to do it at the moment, because we don't know the situation, what will it become in the next month. So that's why they asked. So I'm just trying to respond a comment from the participant, and it's okay. But it's okay now, I think, because even Korea is import their PPE from us. Okay, let's go back to the dentistry part. Okay, can you tell me specifically about how the regulatory body create a regulation about standardization of your office, your practice office?
Okay, so yes, there's a lot of confusion about this as well, and a lot of arguments going on. And I know that there is a dentist in, I think it's Tunbridge Wells, who is doing some actual experiments at the moment on aerosol. He also has laser, and he's trying to do these experiments as quickly as possible. And he was asking people for suggestions on procedures that we could test, because I gather that potentially the worst thing is the aerosol from ultrasonic scalers. So basically what they've said, so they told us we could open, but they didn't give us any guidelines. Guidelines. The day before we were actually supposed to open. So what we have to do is we have to produce a document.
You have to produce a document privately?
Use a document for ourselves.
Okay.
We have to submit to the Care Quality Commission, and it's called a standard operating procedure. Okay. So there are lots of them around that people have come up with.
So everyone will have their own perspective on the preparation.
Yeah. So that is a folder. Okay. That's following the guidelines, but it has to be individualized for the practice. Because every practice is different. So some people only have one surgery, some people have several surgeries. So obviously, in a practice where you have several surgeries, you can maybe just have your aerosol generating procedures in one surgery, and then use the other surgery for your routine exams and stuff like that, which makes it logistically a little bit easier. But because they're saying that if you are doing an aerosol generating procedure, an AGP, the fallow time has to be 60 minutes.
60 minutes between patient.
Minutes, which is, I'm very interested to hear your
that's interesting.
Yeah, so then someone came up with a calculator for reducing that.
Okay.
So they said, if you have other measures in place, then you might be able to reduce that. But this is the problem. We don't have any scientific basis for it.
Yeah. I mean, why did they set the regulation to 60 minutes after patient for another patient? What is the base of it? I mean, scientific base.
I don't know. This is what I've been trying to work out, because I read a paper recently. Admittedly, it was to do with TB, okay, not viruses.
Yeah.
But they were advocating 30 minutes, and that was for ultrasonic scalers. Yeah.
I mean, is there any scientific base for them to set like 30 minutes or 60 minutes between patient?
Well, there is this paper on TB. Now, some people say, oh, well, it's like comparing apples and pears. You're comparing a virus with a bacteria, so it's not the same. Well, okay, but then where did the figure of 60 minutes come from? Because I also heard of a Canadian study that said it took 3 hours for the virus to settle. But, you know, what we're not taking into account here is the fact that we use powerful suction. You're not going to use an aerosol that you're just going to allow it to spread into the surgery with no suction whatsoever. And so if you're basing your assumptions on that, then that's not right.
Yeah, I mean, there's some uncertainty with this science things and everything, because according to Pang, there's journals from 2020. There's he mentioned that there's a possibility of risk by spreading the COVID-19 through aerosol. And there's another journal in 2004, I guess, and it said that after the first SARS virus, I think, it said there is the virus cannot spread to aerosol, because I read some articles that the size of aerosol is less than 5 microns, right? And the COVID-19, I think it's about 3 microns, if I'm not mistaken. So
yeah, that's right.
This virus can spread, can travel from one place to another by this media, right? If the media is larger than the virus, I think logically the virus can, go with the media. But there's two different journals says different things. There's no certainty. I mean, if you make a journal with the research less than 12 months, and what do you get? You get rejection.
Yeah.
But they say nowadays, it's pandemic, it's emergency, it's we can publish by 2 months or 3 months, because the pandemic is started, I think, like maybe let's say it's December, so it's still 6 months. If they say the valid journal is you have to do follow-up for like 12 months, then there's no valid journal actually in the world right now.
Exactly, and this is the problem, isn't it? I mean, I suppose that you can look at what people are doing around the world, which is why this meeting is so useful, because I think what we should be doing is collaborating globally, not just looking at our own country, but looking beyond that, because, if people are using normal PPE, but high volume suction, and they're not getting transmission, then that's really good evidence, isn't it, that we don't have it? Because I don't know about you, but I don't really want to spend the rest of my working days wearing full PPE for an HPV. It's really uncomfortable. I feel like I can't move in it. I haven't even
you cannot breathe.
Yeah. So how are we going to do work to the same standard as we did before, when we are so restricted in this PPE.
So what is the regulation of PPE in England?
Okay, so for an AGP, you have to wear an FFP3 fit
mask?
tested mask.
Okay.
And a visor and eye protection, and a full
coverall.
gown. Yeah.
Or just a disposable surgical gown.
Yes, or they are allowing washable gowns.
Okay. So I think it's almost the same as Australia and America, because in some places they have to use a full coverall, you know.
Mm-hmm.
Yeah, with N95 mask and everything. But is your regulatory body makes that a regulation, or just asking you to use it? Is it a regulation?
Well, the thing is that we have a faculty of general dental practitioners.
Okay.
So they came out with their recommendations, and they said that it would be like gold standard to be wearing that. Now, the issue that we have is, to be honest, for me, I can choose whether or not I want to wear it. That's my, choice.
Yeah.
Okay. But the problem is whether I'm going to put any of my staff or my patients at risk if I don't comply with the regulation. So, I can say, look, I don't think it's a risk for me. I can choose my whether I want to take that risk or not. But if I had a complaint, that the GDC then, the General Dental Council, would look at the FGDP regulations as their go-to standard. Yeah. And then they would ask me, why didn't you follow those? So I have to be able to justify that, which is where the science comes in. Because to get them to relax that, we would have to have the science to back it up.
So do you have to have an air ventilation in your office?
Yeah, so we were told not to use air conditioning, but now
not
they said,
to use.
Yeah, which is in the summer. When you've got all the PPE on and no air conditioning.
Yeah.
People have been joking, saying, "Oh yeah, I moved and I could see like a pool of sweat on the floor." I think they were joking, but and I peeled it off me afterwards. But I know from just doing the fit testing course, having that on just literally 5 minutes, I felt quite claustrophobic in it.
Yeah.
Do you wear these masks, or do you have a hood or anything? Because some people have these sort of hoods. But how can you? Yeah,
it's kind of difficult. I use level 3 PPEs. I use N95 mask, full of coverall, with Google, and because why I'm using a Google, not a visor, because I need to wear my loops.
Yes.
So I just can't work without it, And sometimes I use a respirator mask and modified it.
Yeah. Because
sometimes with the face mask, if it's not too thick, sometimes when you inhale, the mask is following your nose. You will have difficulties breathing. And I have the experience when I have a surgery in my clinics for 4 hours, and then the next hours I have another surgery in the hospital for 2.5 hours. And at the last time when I did the sutures to my patient, and I feel like I'm losing balance a little bit. I'm it's like earthquake, like a minimal earthquake, and you feel like you're moving, but I still can concentrate, but still my balance is decreasing. And I guess it's caused by hypoxia.
Yes.
We have less oxygen in our brain. So what do you think about it?
Yes, there have been reports of people fainting in the hospital because they've been wearing the PPE for hours. And I think it's actually a build-up of carbon dioxide, hypercapnia. Causes the problem. So, of course, the treatment for hyperventilation is to rebreathe, isn't it? So when you're doing that all day, you're going to, depress your respiration. And people, people have been getting headaches. They're also not taking toilet breaks when they should do because they can't take the PPE off. So that's it affects the health of the healthcare worker quite significantly. And it's, what are the long-term health effects going to be on healthcare workers from having to wear PPE like this?
That will be another issue, But
exactly.
Healthcare workers also need to work. That's why.
It's a big problem. And so not only has the science got to catch up, but I think the technology as well. I think, it's a bit like when we had the World Wars, actually. A lot of useful technology came out of a really bad period in history. And I'm hoping that the same thing might happen when people start to really think about this, because we could have another pandemic. We don't know when.
Exactly.
And that's another issue that I wanted to say about the antibiotics, because at the beginning of this whole problem, we were told not to see patients face to face. We were only to provide telephone triage and antibiotics. And for the last how many years, we've been told to reduce the number of antibiotics.
The antibiotics.
With antibiotic resistance. So then it was the only thing we were allowed to do, pretty much. And so what happens if we suddenly start to get lots of antibiotic resistance? What if the next pandemic is actually a bacterial one, like the plague? And we don't have an antibiotic to treat it. We're not going to get necessarily a vaccine for that. So,
you cannot get vaccine in just a short time. Otherwise, you're prepared the vaccine already.
Exactly. So it's a bit like when doctors prescribe medicine for one problem, and then the side effects happen, and then they go, "Oh, well, I'll have to prescribe you something else now to sort that out." So one thing leads to another. So I think we need to, as a global thing, take a step back and go, okay, what can we learn from this, not just for dentistry, just for everyone? How can we change things so that we can have quality of life, but try and learn some very important lessons from this? But I think South Korea, they are a shining light really in this, because they've already learned lessons from problems they've had in the past, and they were trying to tell everybody about it.
No one listened. So you were saying that your practice have been locked down since the end of March. So it's not just you. I mean, it's everyone in UK, right? So how do they going through with their lives? I mean, not all of the dentists have, strong financially. I mean, not all of them. So how they deal with it?
It's a big worry, and there's a lot of people who have been offering counselling and stuff like that, because I think there will be quite a few dental practices that go out of business. And we also, I don't know what it's like in your countries, but we have a lot of practices that have been bought by corporates. And so you have NHS and privates being bought by corporates, but also there's a lot of independent practices, which I'm involved with independent practices. I don't really fancy the idea of working for a corporate, because some of the corporates are more interested in profit margins than quality of care. And also, you don't have the clinical freedom to do dentistry the way you want to do it, because you have to ask permission of where, can I have this piece of equipment? Can I have
Okay,
that?
Lindsey, I have a question here. Do you use an extraoral suction in England?
Well, I don't at the moment, but I'm looking at various options for that. So what I have been using for the last 4 years, actually, this is before even the pandemic happened, was I bought an isolite, which is you put it into the patient's mouth, which is an extra suction, and it sits across the throat. I didn't buy it for that reason. I bought it because I thought it was a really good idea. It's a soft silicone mouthpiece that has a suction on the end of it.
And
it protects the tongue and the cheek while you're working.
While working.
Yeah, so it's like, I think Isolite.
But that's it. Exact. I mean, it's like putting your suction to the device, right? That's only that. I mean. Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to